Now I want to discuss the next drug class that we use for insomnia, and these are the novel benzodiazepine receptor agonists, or they're also called Z drugs because they have all a Z in their name. I want you to remember zolpidem. This is the most widely used drug in the US right now for the treatment of insomnia, so very heavily prescribed. So how do these C drugs work and how do they differ from the benzos? So in terms of mechanism of action, they actually work very similar. So also their target is this GABA-A receptor, and they are also allosteric modulators. So remember what happens at this GABA receptor. GABA binds to a binding site. The benzos and the C drugs bind to a different site, hence the name allosteric. Allos for different, steric for site. Do a conformational change so that the GABA can bind with higher affinity to the GABA receptor chloride. It's going to flow in and you're going to have this GABAergic inhibition. They bind either at the same site or near the benzodiazepine receptor site, so very similar. Now, in terms of indications, you can only use them for insomnia. And that's a big difference to the benzos because remember, they can be used for so many things as anxiolytics, as spasmolytics, as anti-seizure medication. Here, the C drugs only for insomnia, so very important. As it relates to adverse effects, they have adverse effects similar to those that we discussed with the benzos. So similar to benzodiazepines, but less frequent and less severe. That doesn't mean that they don't have any. They also have abuse potential. They also can make you drowsy, psychomotor impairment. It's just not as severe and also less frequent. So if you're comparing side by side C drugs, which have now basically supplanted the benzos with the good old benzos, we should recognize that they have fewer deleterious effects on the sleep cycle. That's obviously a big thing. We want to not change our sleep cycle. We want to have a drug that has very little changes on REM sleep. And it looks like the C drugs have fewer effects on our sleep cycle. Another big thing to remember is they are only used for insomnia, so please don't use them as anxiolytic drugs, for example. Then they have less psychomotor impairment, less anterograde amnesia, less tolerance, less physical dependence, less rebound insomnia, as we discussed for the benzos. But these problems still occur. In fact, particularly for the drug that I want you to remember, zolpidem, they have also found some sleep-related behavior, so that patients did sleep eating, sleep driving, sleep walking without even noticing. So there are adverse effects, and you should be very careful with these drugs. And that's why the FDA also recently did a dose reduction for zolpidem, because there were these reports about the sleep-related behavior, that the patient did this sleep driving, so they drove, got in an accident and didn't even remember. So that's about this sleep-related behavior. And then I also think it's noteworthy to know that they are approved for long-term use. We discussed for the benzos, they should not be used longer than a month. And actually zolpidem is approved for long-term treatment. But always, try to use them as short as possible.